I'm Katie Powell, a research fellow at the University of Sheffield, and I'm going to talk today about the main focus of my fellowship, which is about the way in which theories of power and place can support local action on health inequalities. And the rationale for this is that evidence shows there are a wide range of theories from the social sciences that define place and its relation to health disadvantage, but that these are underused in practice. Examples include neo-materialist and intersectional perspectives on health. These theories provide a starting point from which to explain how planned public health interventions relate to long-term social and political processes that sustain health inequalities. The limited application of these ideas affects how health inequalities are defined and which actions are pursued to reduce them, contributing to the lifestyle drift that's been well documented in public health practice. So why are socio-political frameworks underutilised in public health? Well, first, power inequalities constrain action on the status quo. Research shows high levels of understanding about the socio-political drivers of health equity among lay people, public health practitioners and policymakers. But everyday practices make it hard to enact those understandings. For example, those in more established positions of power and those fearing a threat to their own status or economic position are less likely to acknowledge the role of structural influences on health. Individualised behavioural theories in public health also crowd out socio-political theories. Reviews repeatedly show the dominance of psychological behavioural theories on intervention development, and the influence of those ideas in the public sphere have been shown to hinder policy action on the social determinants of health. As well, nationally and locally, spaces to develop and operationalise collectively held explanations for health inequalities have diminished. Austerity, for example, has hampered professional collaboration and public engagement, and consequently there's limited coherence across academic, policy, practitioner and lay narratives relating to health. My fellowship will be used to design a participatory action research project to explore how to better align explanatory frameworks used by academics, lay people, practitioners and policymakers to reduce place-based health inequalities, and to explore which theories of power, place and health are most useful in local practice to reduce health inequalities. The project will engage lay people, practitioners and policymakers in one local authority region to produce a framework for explaining local health inequalities that engages sociological theory into place-based inequalities. Please share your questions and feedback.